Hello, my name is Brett Wise, and I'm a researcher in the Technology-Enabled Clinical Improvement Center under the direction of Dr. Carla Pugh. My poster is titled Feasibility and Interest in Establishing a Longitudinal Surgical Skills Performance Database. Is it possible to assess surgeon skill at a large scale? Are surgeons even interested in this data? Currently, there's a strong interest in artificial intelligence, big data, and video-based assessment and coaching for practicing surgeons. To facilitate this, there is a need for databases that capture each of these elements and provides a platform for assessment of self and peers. This project explored the feasibility in surgeons' perceptions of the utility of a longitudinal skills performance database. At the 2019 American College of Surgeons Clinical Congress meeting, participants completed a simulated porcine bowel repair at a 10-station skills assessment booth located in the exhibit hall. Participants voluntarily completed a 14-item pre-survey that asked them about self-demographic information such as age, gender, specialty, and years as a practicing physician. Surgeons were also asked about the breakdown of their workload and what percent is clinical and spent operating, as well as any administrative responsibilities that encompass greater than 50% of their workload. Participants indicated their interest in contributing to a longitudinal database and tracking their performance using this database. They were also asked about their interest in using the database for self-assessment and whether they believe there is an ethical obligation to have surgeon skills and judgment tested in order to protect the public. An exit interview was completed on a subset of 23 participants to assess their motivation in participating in the study, their experience in completing the hands-on skills assessment, and their thoughts about standardized testing for surgeons or peer evaluations of efficiency feedback or technical skills. Chi-square tests and grounded theory were used for statistical analysis. Demographic analysis revealed that participants ranged in age from 29 to 77 years old. Years in practicing surgeons range from 1 to 45 years with fairly equal distribution in each participant pool. Specialties of participants included general surgery, minimally invasive surgery, trauma surgery, colorectal surgery, surgical oncology, and other. 96% of surgeons reported interest in contributing to a longitudinal performance database and tracking their individual performance using this database. 98% expressed interest in using this database for self-assessment if the database were reliable and confidential. Additionally, 82% reported there was an ethical obligation to have skills assessment to protect the public. During the analysis of exit interview responses, we observed that regarding standardized testing for surgeons or peer evaluation, participants largely expressed interest in a low-stakes formative assessment while also creating a safe and supportive environment. In conclusion, large-scale skills assessment testing is feasible, and the national or regional scientific meetings may be the ideal location for such testing. This study also identifies specific interests in safe and supportive environments for skills assessment and surgeon interest in performance databases that allow information sharing and peer or self-assessment. It is important to keep surgeons engaged in the process of developing a longitudinal skills database. Thank you for your time.